PanCAN has been dedicated to fighting pancreatic cancer in a comprehensive manner for over 20 years. And in one of those ways is through our various research and clinical initiatives. And they include programs such as the Know Your Tumor program, which is our molecular profiling service, Precision Promise, which is an adaptive clinical trial program, Early Detection Initiative, which is an initiative to understand, early detection, essentially, of pancreatic cancer. And then we capture patient-reported outcomes in the form of surveys in our patient registry. So all of these initiatives generate a tremendous amount of data. And these data assets include molecular, multi-omic, patient-reported outcomes, as I said, imaging data. And so we determined that a centralized repository such as Spark, where all of the data sort of is housed, but then also allows researchers to analyze the data was sort of a next sort of step, a next logical step. And our intended purpose essentially is to get data into the hands of researchers so that they can gain insights, rapidly and quickly to ultimately improve patient outcomes. So related to the design of Spark, Spark leverages a platform built by a company called Valsera 7 Bridges. And so Valsera 7 Bridges builds cloud-based systems that are designed to support biomedical data. So it was perfect for us to sort of leverage the platform that they have and then customize it for our needs. And so just a little bit about what it has under the hood. It contains a interactive cohort browser. So a lot of times researchers want to be able to explore certain cohorts based on clinical or molecular features. And you can do that with this interactive cohort browser. And you can query sort of the information. There's also another, if users are interested in just downloading or just accessing all of the raw files, they can access the files for each of these, data assets I mentioned through an interactive file repository as well. And the initial release of Spark, as we mentioned in the paper, it's a pilot release, contains de-identified clinical, molecular, genomic, transcriptomic, and pathology image data for over 600 patients that are enrolled in our Know Your Tumor molecular profiling service. The goal eventually is to bring in the other data from the other programs, but for now, the initial release contains data from our Know Your Tumor program. So primarily, initially when they log into the system, they're presented with an interactive cohort explorer or browser that allows them to sort of query and build cohorts based on these clinical and molecular features. But there's also something called a public apps gallery that contains over 700 bioinformatics pipelines and workflows for analyzing the raw data. So this is primarily also why we partnered with Valsera 7 Bridges, because this is kind of part of the built-in technology of the platform. So and continually, as new bioinformatics pipelines become available, they always integrate them into the system. So that's one way to analyze data. For those who want to do more stats and create plots and visualizations for publications and things like that, there's an interactive data studio that contains R and Jupyter for the analysis of data. So all analyses on Spark are traceable and fully reproducible. The main sort of framework is a project workspace. So users, they can copy and bring data, including those workflows I mentioned, into this project workspace to conduct their analyses. And once everything is in a project workspace, when and how and what tools were used are all sort of captured. So the tasks, so sort of, these are called tasks, are all captured in terms of what input files were used, what were the parameters that were used. And so essentially it's keeping a detailed log. And so if somebody wants to go back to look at, okay, well, what did I do, a month ago, you can see all of the tasks essentially that you've ran. Because we want to keep things, or the platform tries to keep things traceable and fully reproducible, once executed tasks can't be deleted or modified, just so that, the information, then we can ensure that it's fully reproducible and traceable. Yeah. And then data governance is, or provenance is also ensured as files and data are generated by these tasks are then linked to those tasks. So you can know which file you used and which version of the file. So as, files and data gets updated, you downloaded or, moved data into your project X date. And so, a future iteration of the data might have changed, but you have the data from that time and you can sort of trace it in that way. Right now, we're continuing to quarterly update the data from the Know Your Tumor program. And we plan on integrating the data from the other research and PanCAN's other research and clinical initiatives. That's our plan. But in addition to the PanCAN patient health data, we also want to ensure that our users have up-to-date publicly available data resources. So data such as, coming from the Cancer Genome Atlas or the Human Tumor Atlas Network, which is a new sort of public initiative. So through the Valsera 7 Bridges, they have another instance called the Cancer Genomics Cloud. We've sort of created a bridge so our users can access the publicly available data sets that are also in that platform as well, so that they also have access to the publicly available data. But we're also continuing to add new bioinformatics tools as they become available, and we're looking into the addition of clinical data visualization capabilities as well. Initially, the first ideal goal, I think, for us is that Spark becomes a go-to resource for researchers to access the rich de-identified pancreatic cancer data that PanCAN generates. I'll sort of plug our paper here, but the journal editor, I think it's in the context box if you look back at the paper, but he kind of said that, platforms like Spark, I'm paraphrasing, but platforms like Spark democratize access or will help democratize access to real world data sets and other differentiated data sets that are not readily available in the public space. And so our hope is we can give researchers access to these rich data that, they can eventually glean insights that will lead to contributions in the field, or even better, to improve, patient outcomes. We hope that Spark fosters collaboration among researchers, and together, when they work together, their combined efforts, also can help improve the lives of patients with pancreatic cancer. And also another interest for us is, as I mentioned, we want Spark to be the go-to resource for pancreatic cancer data, not only PanCAN data, but we would hopefully have the pancreatic cancer research community contribute their data to Spark, so that, we're bringing in data from their own labs or their own institutions, and then sharing that with their colleagues. So because more data brings more insights, and more insights brings progress in the fight against pancreatic cancer.